Welcome back to Health Communication. For this brief discussion, we're going to talk about the term health literacy. And it's basically used to describe, I'll give you the American Medical Association's definition, the ability to access health information, the ability to understand it, and the ability to use it. So not just receiving health information passively, but knowing what to do with it, and when it comes time, being able to translate that into practice. So for this part of the lecture, we're going to talk about, again, a little bit more about what impacts health literacy, what does it mean to have low health literacy, what does it mean to have high health literacy, and then how can we create health communication efforts, whether it's health promotion campaigns, to try to increase patients' understanding and usability of health information, thereby increasing their health literacy. Okay, next slide. There we go. All right, so again, according to the American Medical Association, it's the ability to access information, to understand it, and then to use it. And so I want to give you also a definition by the U.S. Department of Health and Human Services. It's the degree to which individuals have the capacity to obtain, process, and understand basic health information and services needed to make appropriate health decisions. You all have shared encounters about successful and less successful times in which you've been in a healthcare setting. And sometimes you've had wonderful providers who've really gone above and beyond to describe what is your condition and what are next steps for what you can do to help empower yourself to improve your health. But I've also read examples in your blogs about healthcare providers who were rushed, who come in and have this very paternalistic attitude, just rattle off some health information, and don't really assess whether or not you understand what they're saying. Well, that's not necessarily productive in terms of, again, empowering patients to be able to take care of their own health. Here's an article that I found called Health Literacy, Applying Current Concepts to Improve Health Services and Reduce Health Inequalities, where it shows you where in clinical settings how health literacy is helpful for, again, patients to be able, or community members to access and utilize health information, and even know how to interact with health service providers, how to ask questions, how to clarify information, how to make shared decisions when it's appropriate. And then also in community settings, how to empower community members to take care of their own health. So take, for instance, to actually utilize prevention resources, to take advantage of screenings for early detection, and then how to use information for health debates, but more importantly, I believe, is how to use that for decision making, how to make informed decisions about your own health care. There's a little bit of overlap with the clinical settings, the use for health literacy in clinical settings and community settings. Again, as future healthcare practitioners, I want you to start taking into consideration that it's really critical for patients to be able to understand their care and be informed and empowered to make good health decisions and use health information. Also, health literacy is so much more than general literacy, just that general ability for reading. It includes numeracy, it includes other aspects other than an individual's ability to read. So what are some hazards of a patient having low health literacy? Well, as you can see in this picture that was created by the CDC, it's linked to increased visits to an emergency room. If any of you know anything about where you receive care and cost, that's one of the costliest places, as well as you're at greater risk when you're receiving care in an emergency room potentially, as opposed to if you were able to use information for the prevention and control of disease. Patients with low health literacy have more hospital stays, they're less likely to adhere to medical treatment, and generally have higher mortality rates. This could be due to they're more likely to misuse medications or miss health appointments, less able to understand a provider's explanation of their illness and processes of healthcare, and less able to participate in the treatment decision making. So what are some benefits of having higher health literacy? you're able to ask more questions and participate. Patients who've had higher health literacies previously have asked more questions and participated more in the healthcare visit. Here are some citations, and I've got information on these sources if you decide you're interested in checking these out. They can better understand healthcare issues. They can make better informed decisions, which also impact their treatment and also the way that they manage their own healthcare. And they tend to spend a little bit less time in hospital care. So again, here are those resources in the case that you want to read up a little bit more about the role of health literacy. And again, these are largely published in, well, interestingly, it looks like public health and medical journals, but you'll also find a fair share of these journal articles that are published on health literacy to be housed under health promotion and health communication journals. So what are some of the factors that impact health literacy? Well, now I already mentioned that health literacy is not just general literacy, but general literacy and the ability to read information does impact health literacy. Take, for instance, that someone gives you some kind of pamphlet, which for the longest time health promotion practitioners thought, aha, we have found a way to empower people to take care of their health. We will give them a pamphlet. Well, that's great if you've got general literacy skills, and it's also great if there are factors in your built environment, in your general environment, that allow for you to translate that information into practice. I always like to ask my students in the Introduction to Public Health class, how many of you have ever had a health-related New Year's resolution? Most of the time people raise their hands. How many of you have kept it? There are those weird few that are really good about keeping their New Year's resolutions. And for other people who didn't keep their New Year's resolutions, one of my questions was why or why not? And trying to also get at the fact that, well, didn't you know the information that you needed to change that behavior? Weren't you able to read information about it? Weren't you given the adequate amount of information to make that behavior change? And also another point of that question is to show that behavior change is difficult, especially when it involves habits and when it involves triggers. We're going to keep moving on. Age impacts health literacy, so those who are younger have a harder time taking health information and translating into practice, and also older adults can have greater difficulties with health literacy. Pre-existing disability can impact health literacy. Language. I find this one really interesting because just because health information has been translated from one language into another does not mean that your target population is going to understand that translated health information. The translated health information might be using terms that are not commonly used in, say, a particular dialect. It might not be a very good translation in general. You're not guaranteed that the person with whom you're communicating has general literacy in their, say, native language. There might be just, again, more issues that kind of go hand in hand also with culture as to how information is communicated as to whether or not people can have an easier time explaining it. There's also that issue of information being taboo. Is the topic something that can be openly discussed in particular cultures? Is this new way of describing it something that's, palatable to that person? Or do we need to even break down certain bits of information into other types of steps that information can be useful? By the way, I also want to note that just because a person might have low health literacy does not mean that that's due to a lack of intelligence, nor is lack of general literacy a sign of lower intelligence. Again, it's often often health literacy is impacted by so many different aspects besides also formal education and intelligence. And so I just wanted to make sure to note that it doesn't necessarily reflect the person's intelligence. You can have someone who is extremely smart and also people who are extremely well educated who at times have lower health literacy dependent on certain topics. Here's another great example: emotion. When emotion interferes with the communication of health information. Let's take, for instance, you were to receive a diagnosis you weren't expecting. Maybe you received a cancer diagnosis, or you received information that you were pregnant, but now you're miscarrying, and you're so emotionally charged that everything after that original diagnosis or after that original statement is just a blur. That will impact your ability to take information provided to you by your healthcare provider and act on it in the future. So again, all of these things can interplay. They're not necessarily isolated, but all of these can really interplay and impact people's ability to understand health information that a healthcare provider is sharing. So also, there's the matter of jargon, right? Different disciplines have different words, language, etc., that they use more commonly. And sometimes when you're working day to day in that language, you start assuming that everyone knows what you're talking about. A really interesting example of this is that not long ago, I was giving a healthcare presentation, and one of my collaborators is a dentist, incredibly smart, a great instructor, but we were presenting to mostly community members who weren't trained in dentistry. And some of the terms that this collaborator was using was assuming that the general population uses these terms regularly to describe different, like, sores in the mouth. That's an example, different lesions, but different sores in the mouth that are due to an infection. So if you ever think of the eat this, not that, this chart is kind of a use this, not that, right? So sometimes using words like adverse, you could have clear communication by saying bad. Instead of using excessive, you could say too much. Again, without saying lesion, you could use the word sore. So really trying to, especially in your written communication, when you're using verbal written communication, try to find points in which the language might be at a little bit of a higher level and try to reduce it to a 6th to 8th grade reading level. I'm sure most of you have Microsoft Office Word. There are actually readability tools that are built in where you can look at your information, and by simply clicking a button in Microsoft Office Word, you can get the readability score, which will give you a couple of different readability scores. One's like the Flench-Kincaid. There are a couple of different measures that will tell you at what level, at what reading level your information is. So just in general, using 6th to 8th grade reading level is good and helpful for enhancing patients' health literacy. There are other methods that help with plain language, using an active voice. I think in some of your blogs I've actually recommended switching from a passive voice, this happened to such and such, to this person or thing did this, right? Like, or again, just using who is doing what and trying to create that active voice as opposed to a passive voice. Using common words that are easier to understand, keeping information short, and really trying to take advantage of some white space when possible. If you have just a wall of text in general, you start losing your readers. Again, this is for written communication. Use more of a positive, friendly tone, making sure that the order is logical. By the way, when in doubt, have someone else who isn't in, quote unquote, that health information daily to review it and tell you if what you're writing, what you're trying to convey to a target audience, if it makes sense. If it makes sense of the order, if it makes sense of the tone, if you're using the same type of tense throughout. And again, there's some designs that make certain reading materials easier to read, using bullets, using headings and subheadings, pictures to try to convey a certain message or image. So take, for instance, if you're trying to describe to someone how to take their medication, I remember there was a research study that was trying to test the enhancement of health literacy by, instead of saying take twice daily, in the morning, having two, and then like the little time sign, which looks like an X, and then a sunshine, right? Or other ways to say take on an empty stomach, but then convey even further. That means stop eating 2 hours prior to, or 12 hours prior to a surgical procedure. So also just being clear with what your instructions are and not assuming that people completely understand what you mean. Because again, if you're in a healthcare setting, you're used to these directions, it's almost as though your blind spots are just that. They're your blind spots. You don't really see what people who are not in that information daily might see. So trying to use multiple forms and formats for information tends to be helpful in enhancing literacy, whether it's auditory, visual, kinesthetic, or mixed of these different types of styles. Some people are really great at listening to health information and being able to process it and use it. Some really do better with text and formats and graphs and charts. Some do better when they're a bit more interactive with the health information. For some of these patients, teach back. Okay, tell me, what would be helpful. Teach me again, or tell me what I just conveyed to you. Now, the purpose of doing teach back is not to, again, treat the patient as though they're less intelligent. It's really just to make sure that that the patient has the takeaway message and can actually use the information that you're giving, that they're receiving. Other tips for communicating health information: evaluating the messages for effectiveness, pilot testing, whether it's in a focus group of 6 to 8 people, or whether you just get someone who's, not as familiar as you, or someone who's even more familiar than you with reviewing the information, making sure it makes sense. When you test it, when you pilot test the information with multiple people, are the folks that are receiving this information getting the same takeaway message? That's a good question, again, just to say, if this was going to be a cue to action, like, okay, you could take this information and use it, what would you do next, right? How would you use this health information? Evaluating messages for cultural appropriateness. Again, does the language make sense? Did you use Google Translate, which sometimes has great translations, or did you actually go through a translation company and that company, translated and back translated the information to make sure that it was accurate? The idioms that you're using. I think to say you're pregnant in Spanish is like dar una luz, like to give light. And if you were to say to give light in an English language pamphlet to, maybe a couple that were trying to conceive, they're like, what are you talking about? I don't know what you're talking about. And then the same thing, if you were to use different English phrases and try to translate it to another language, it might not make any sense whatsoever. So really having someone review this with you, for you, or having a professional translation company that is certified to translate that information, and then also pilot testing it, is a really good way to make sure that information is well written and accurately written. And are the pictures and graphics appropriate? Are they culturally tailored? Do they somewhat are targeted? Do they somewhat match the community with whom you're working? And again, this doesn't necessarily just fall under cultural appropriateness, but do the images that you use, those images, do they actually help further clarify any health information, or did you just think it was going to be pretty, right? I mean, there's a time and place for making health information more attractive, but if you can take harder to understand health information and make it clear by including a graphic, fantastic, right? Just one more form of a visual form of education, or a visual form of learning that you might help enhance the clarity of that information. And again, this was mentioned earlier, focus on action using active tense, and just think about what do you want your audience to take away from this health information, from again, this verbal encounter or written encounter or health communication campaign. What do you want people to do with that information? There are also different resources that are aimed at helping patients ask questions to clarify what's going on in their clinical encounters. This is something that's been out for a while called Ask Me 3, and there are 3 questions that you can really try to coach patients to use to clarify the health information they're getting. So, what is my main problem? What do I need to do? And why is it important for me to do this? So these 3 questions, if you really encourage patients to clarify this information, it can help enhance the communication, and also really encouraging patients to say, hey, I don't understand. Could you re-explain this? Or could you help me better understand this? Is one way to empower patients to receive health information and hopefully to be able to put it into practice. That's why that number 2 question is really critical. What do I need to do? What would you recommend that I do? So that's definitely not. That's just this is a primer on health literacy. If you have any questions, feel free to email me. It's I believe a fantastic topic that really intersects with health communication, public health, and healthcare delivery and medicine, and is really critical, again, for people to be able to understand and utilize health information to empower themselves to live healthier lives. And that's it.